If your knees ache when you stand up in the morning, or your hips protest after sitting in a car for an hour, or your fingers feel stiff when you try to open a jar, you are not alone. According to a 2024 CDC data brief, nearly half of all adults aged 65 and older in the United States have been told by a doctor that they have some form of arthritis. And among those aged 75 and over, the number climbs even higher. But here is what most people get wrong about joint pain after 65. They assume it is one thing, one cause, one inevitable sentence handed down by time. In reality, the pain you feel in a joint is almost never coming from a single source. It is usually the result of several factors stacking on top of each other. Some you cannot change, and some you absolutely can. Today, I am going to walk through 7 of the most common reasons why joints hurt more after 65. And for each one, I will tell you what the research says you can actually do about it. Some of these will be familiar. Others might surprise you. And at least one of them, most doctors never mention unless you ask. Reason 1 is the one everyone knows, or thinks they know: osteoarthritis. It is the most common form of arthritis worldwide, affecting roughly 528 million people. In the United States, an estimated 80% of adults over 65 show radiographic evidence of it, but only about 60% of those actually experience symptoms, which means having osteoarthritis on an X-ray does not necessarily mean it is causing your pain. That distinction matters. Osteoarthritis was long described as wear and tear, as if your joints simply wore out like brake pads. But that framing is outdated. Current research describes it as a disease of the entire joint, involving cartilage breakdown, bone remodeling, and, this is the important part, active inflammation. The cartilage that cushions the space between your bones does thin over time, and that thinning can cause pain, stiffness, and reduced mobility, especially in the knees, hips, and hands. But cartilage does not have nerve endings. Much of the pain actually comes from the surrounding tissues, the bone underneath, the joint lining, the ligaments and tendons. And there is another piece of this that most people miss. Your joints do not operate dry. They depend on something called synovial fluid, a thick liquid that lubricates the joint, cushions the cartilage, and delivers nutrients to the tissues inside. As you age, your body produces less of this fluid, and the fluid it does produce becomes thinner and less effective. When synovial fluid thins out, cartilage loses its cushion, friction increases, and the joint stiffens. Think of it like a door hinge that is slowly running out of oil. The hinge is not broken. It just needs lubrication to move the way it should. What you can do right now: movement. This sounds counterintuitive when a joint hurts, but the European Alliance of Associations for Rheumatology, EULAR, lists exercise as the first-line, non-negotiable recommendation for managing osteoarthritis. Gentle, regular movement helps maintain cartilage nutrition, strengthens the muscles around the joint, and reduces stiffness. Not rest, movement. But if you are wondering whether there is something that targets the synovial fluid directly, supporting your body's ability to produce hyaluronic acid as you get older, there is a short video from a joint health researcher that walks through a specific protocol for that. It is not a replacement for what we just covered, but it addresses a piece of the puzzle that exercise alone does not. QR code is on screen right now, and the link is in the description and pinned in the first comment. Reason 2 is one that connects to nearly everything else on this list: chronic low-grade inflammation. After 65, your immune system shifts. It becomes less precise and more reactive, producing inflammatory molecules even when there is no infection to fight. Researchers call this inflammaging, and if you have seen our other videos, you know it connects to nearly everything. In osteoarthritis, specifically, a 2024 review published in Clinical Rheumatology confirmed that inflammation is a recognized phenotype of the disease and is associated with worse pain and faster joint deterioration. What can you do? Reducing processed foods, cutting back on added sugar, eating more omega-3 fatty acids from fish, and staying physically active all help lower systemic inflammation. This is not a quick fix. It is a slow cumulative shift. But the research shows that dietary patterns like the Mediterranean diet are associated with lower rates of osteoarthritis and better outcomes in people who already have it. Reason 3 is the one that ties directly to independence: muscle weakness around the joint. Your joints do not exist in isolation. They are supported, stabilized, and protected by the muscles around them. When those muscles weaken, the joint absorbs more force with every step, every turn, every time you stand up from a chair. Your quadriceps, for example, are the primary shock absorbers for your knees. When they lose strength, which happens naturally after 65 if you are not actively challenging them, your knee takes on stress it was never meant to bear alone. A 2023 systematic review in Frontiers in Public Health found that lower body strengthening exercises significantly improved both strength and mobility in adults 65 and older and were associated with reduced fall risk. What you can do: strengthen the muscles around the joint. Chair stands, wall push-ups, and even short daily walks all help. You do not need heavy weights. You need consistency. 10 repetitions of standing up from a chair twice a day can change how your knee feels within a few weeks. Reason 4 is one that far too many people never investigate: vitamin D deficiency. After 65, your skin becomes less efficient at producing vitamin D from sunlight. You may spend more time indoors, and your kidneys become less effective at converting vitamin D into its active form. The result: a large percentage of older adults are deficient without knowing it. A longitudinal study published in the Annals of the Rheumatic Diseases followed 769 older adults for 5 years and found that moderate vitamin D deficiency independently predicted the onset or worsening of knee pain, even after adjusting for obesity, radiographic osteoarthritis, and muscle strength. Vitamin D plays a role in calcium absorption, bone mineralization, muscle function, and immune regulation. When levels drop, bones soften, muscles weaken, and inflammation increases, all of which feed joint pain. What you can do: ask your doctor for a simple blood test, a 25-hydroxyvitamin D test. If you are deficient, supplementation is inexpensive and effective. The NIH recommends at least 600 to 800 IU per day for adults over 70, though many practitioners suggest higher doses for those who are deficient. Eggs, fatty fish, and fortified dairy products also contribute. Reason 5 is the one most people know but underestimate: excess body weight. Every pound of body weight translates to roughly 4 pounds of pressure on the knee joint during walking. That means 10 extra pounds creates 40 extra pounds of compressive force on your knees with every step. Over thousands of steps a day, Over months and years, that load accelerates cartilage breakdown and amplifies pain. A 2024 review in Therapeutic Advances in Musculoskeletal Disease noted that metabolic syndrome, the combination of obesity, high blood pressure, and insulin resistance, affects 59% of patients with osteoarthritis, compared to 23% of those without. The relationship runs both ways. Weight worsens arthritis, and arthritis limits the movement that would help with weight. What you can do, even modest weight loss, helps. Research consistently shows that losing just 10% of body weight significantly reduces knee pain and improves function. And the effect is not just mechanical. Losing weight also reduces systemic inflammation, which is reason 2 on this list. Reason 6 is one that almost nobody talks about: dehydration. Cartilage is roughly 60 to 80% water by weight. That water is what gives it the ability to absorb shock and glide smoothly within the joint. When you are chronically underhydrated, cartilage loses some of that cushioning capacity. And older adults are particularly vulnerable. The thirst mechanism weakens with age, kidney function changes, and certain medications increase fluid loss. This does not mean drinking more water will cure arthritis, but chronic mild dehydration may quietly amplify the stiffness and discomfort you feel, especially in the morning. What you can do? Track your fluid intake for a few days. Most older adults need roughly 6 to 8 cups of fluids per day. Water, tea, broth all count. If you notice your urine is consistently dark yellow, you're likely not drinking enough. It is a simple thing, but simple things compound. Reason 7 is the one most doctors do not bring up unless you ask. Medication side effects. Statins, the cholesterol-lowering drugs taken by millions of older adults, are among the most common culprits. Muscle pain and joint stiffness are well-documented side effects of statins, reported in roughly 5 to 10% of users in clinical trials, and possibly higher in real-world settings. Some blood pressure medications, proton pump inhibitors, and aromatase inhibitors used in breast cancer treatment can also contribute to joint discomfort. The problem is that when you are over 65 and already dealing with age-related aches, medication-related joint pain blends in. It feels like more of the same. But if your joint pain started or worsened around the time you began a new medication or changed a dose, that timing is worth mentioning to your doctor. What you can do: do not stop any medication on your own. But do bring a list of your medications to your next appointment and ask directly, could any of these be contributing to my joint pain? Adjusting a dosage, switching to a different formulation, or even changing the time of day you take a drug can sometimes make a meaningful difference. So, putting this all together, joint pain after 65 is rarely one thing. It is usually a combination: cartilage changes, thinning synovial fluid, background inflammation, weak supporting muscles, nutritional gaps, body weight, hydration, and sometimes the very medications meant to protect you. The encouraging part is that several of these factors are within your control. Movement, diet, hydration, vitamin D, and a conversation with your doctor about medications. None of these are dramatic interventions. They are adjustments, small ones. But they address the actual causes, not just the symptoms. And if the synovial fluid piece stuck with you, if that is the part of your joint pain you want to address, the video I mentioned earlier lays out a clear approach. I think you will find it practical. QR code is on screen. Link is pinned below. If you have been living with joint pain and assumed there was nothing left to try, I hope this gave you at least one new angle. Pain that you understand is pain you can begin to manage. And managing it is the difference between sitting the day out and actually living it. In the comments, tell me, which of these 7 did you not know about? I have a feeling number 4 and number 7 are going to come up a lot. If this video helped you see your joint pain differently, a like goes a long way toward getting this to people who need it. The natural next step from understanding why your joints hurt is building the daily habit that keeps them moving.